So after watching Samantha Pina's personal story about living with OCD, it kind of explained a little bit more about the severity, is a good way to put it, of truly having OCD and living with it. I was really surprised to learn, especially like as a young child, like when she got pushed into the pole or the metal by her brother, that she continued to run herself into the metal so that both of her arms, so that she would have some equilibrium in her body. It was that extreme, like she couldn't stand one arm to feel pain and the other not to. I had never really considered OCD to be that severe in a sense, especially when it comes to pain. Um, but learning that it can really shed a light on that to me. Um, I think a lot of people, society kind of throws the term OCD around, and we kind of downplay it a little bit. Like if someone is just very organized, they might have, a good way to put it is they have OCD tendencies, like they might wash their hands a lot or be very organized, and we might say, oh, well, you're OCD. In reality, they don't live with the things that someone who truly does have OCD does. Coming into contact with a client that has OCD, some things that you might want to consider biologically is a history of mental illness. Maybe someone in their family has it, or maybe, they might have another mental illness, just anxiety, and it's just present in the family. Psychologically, I would probably try to pay attention to their tendencies, just like Samantha said, are they, like when you shake their hand, do they have to have their other hand also shaken? Or, like if you pat them on the back or on the shoulder, do they have to pat themselves on the other side? Things like that. Or, do they have to wear, one of the textbook examples was wearing gloves. That would be a good thing to pay attention to, things like that are just very extreme, Samantha was talking about how she had to be extremely organized and she would rewrite her notes every day. Things like that would be something to look at, pay attention to with someone that has OCD. Socially, I would pay attention to maybe who they consider their family and their friends, how they perform in their job. Are they in school? How they're performing in school if it's a child. Just things like that. I feel like those would all be very good indications of symptoms of OCD. Anything like Samantha, though, I could imagine, like she says, it is, I don't think it's easy to live with, but I do think that, like, the tendencies of, and the symptoms of OCD do bring positive things to the table. Like, she performed extremely well in school because she was a perfectionism, but on the other hand, she did have that extreme anxiety, and she did have that need to feel perfect or to feel like things were perfected. Besides that, this video, it really showed me, how extreme OCD can be rather than just the way society throws it around loosely.